I'll introduce myself. My name is Zina Abud Hassan. I am the current co-president of NAAMA NextGen National, along with Ryan Jarudi, who's also present here on the call. I'm going to start off giving a brief presentation on the application along with what the internship in Lebanon entails. And then the second portion of today's info session, we'll have the opportunity to hear from past interns that have been in Lebanon, and you'll also have the opportunity to ask some questions in the end. If you have questions, feel free to leave them in the chat throughout, and then we'll get to them to the end. And if you want to vocalize your question, we'll take those at the end. So this internship would not have been possible without our partners. We are partnering with the Ahmed Association International, where we've been able to work with them for the past 3 years. And they have community centers all across Lebanon, where you'll have the opportunity to volunteer and shadow physicians there. We also are partnering with the American University of Beirut. We have the generous support of Dr. Hitte, who is a current emergency medicine physician at AUBMC, where you'll also have the opportunity to get involved on research and shadowing with AUB and other faculty members there. So what is the NAAMA NextGen internship in Lebanon? Basically, you'll have the opportunity to be in Lebanon for 2 weeks, and you'll be able to volunteer and also do some shadowing with both Hamid and AUB as well. And if you're interested, we'll also have opportunities opened up for research involvements, and also you'll be able to enjoy Lebanon itself through other cultural activities throughout your time there. So what your experience may look like, and I say may because our experience is very flexible to everyone's interests, but this is the general gist of what we have for the program. Basically, the first week you'll be on orientation with Ahmed, and you'll be able to visit their community sites. And then the second week, you'll really be able to get more involved on the ground, shadowing at the clinics, and also being able to observe at other rural health centers with Ahmed. And then if the opportunity arises, you can also shadow with the AUB Medical Center, whether with Dr. Hittin, the ED, or if you're a medical student and you have an interest in a specific specialty, we'll be able to work with you and find a faculty member that may be able to support you and be able to bring you on to shadow. So these are the eligibility requirements, which are also on our website. But the main things to keep in mind is you must be a registered dues member of NAAMA NextGen to apply, and also be fluent in Arabic, being able to speak and understand Arabic, and even some medical Arabic as well. So this right here is the application. It's very, very simple. All of this is found on our website. You'll just submit a letter of recommendation, your CV, and a cover letter why you should be chosen for the internship. And then we have a quick little waiver to sign as well. This right here is our estimated cost for being in Lebanon for 2 weeks. We will be able to provide some financial support on a case-by-case basis that will be determined after we determine if you are fit to be involved in this internship. And lastly, here is our application timeline. The application closes on Sunday, January 18th. So we've extended it to give you guys some extra time. And we'll be starting interviews end of January, early February. And you should be able to know if you got accepted February 20th, so you can coordinate your flights and everything. And if you are accepted, you'll be able to meet with the AMA team in March. And then the start date will be around mid-May/early June. This is very flexible right now, as we'll finalize exact dates and logistics and scheduling closer to your visit. So all of this is found on our website, naamanexgen.com. Obviously, if you have any questions, feel free to always email us at our national email. And also we'll have opportunity today to ask questions and also just hear from others that have experienced the internship in Lebanon. So I'm going to stop sharing right now, but we're going to move on to my most excited part of today's session is hearing from past interns that we have today. So Omar, Ziad, and Neil, thank you so much for joining us tonight. So if you can all introduce yourself, just your role in NAAMA NextGen, where you are in school, when you visited Lebanon, and for how long.
Yeah,
I think
definitely.
Ziad, you should start us off as the first person who visited Lebanon and, toured the Amal Association health centers.
Well, thank you, Neil, for I guess, the introduction, part of the introduction. I'm a second year medical student at Northwestern. Like Neil said, I was the pilot, I guess, or one of the pilot. There was someone that went before me actually, so I'm not the first, but I was the second. Um, and yeah, I went to Amil 2 years ago now, during one of during a gap year. And then I went last year for 2 weeks. The first time was 3 weeks, last year was 2 weeks, so it was a great time. And my involvement in NAMA, I'm currently the president of NAMA's chapter at Feinberg School of Medicine, the Northwestern Feinberg School of Medicine. And I was involved before that too.
Ziad is not mentioning he is the founding president of the University of Michigan chapter undergrad as well. All right, I'll do a quick little introduction for myself. I'm Omar Fahmi. I also served as president at the University of Michigan undergrad. Now at the University of Michigan Medical School, was on the national board and president, and now the national vice chair. I had the privilege of going to Lebanon and being able to spend that time with the Amal Association and AUB last summer. I was there for about 2 months, and Neil was able to join me as well for a few weeks. So I'll hand it off to him.
Hi, everyone. My name is Neil Nakash, and I'm the director of programming, newly onboarded. So I'm really excited to be working with everyone here at the e-board. But like Omar said, I was in Lebanon this past May, well, May 2025, and I was there for 17 days. So not quite as long or extensive as Omar and Ziad, but I still had really good exposure there. And, I'm really looking forward to speaking more about my experience with Amel with you all.
I'm so excited to hear from all your stories and your experiences. And I think that's all what we want to hear tonight. Your experiences on the ground. I mean, myself included, I'm heading to Lebanon this week. So I'm really excited to hear kind of your experiences in Lebanon on the ground. So, what did a regular day kind of look like for you when you were in Lebanon? What were, your main activities that you were involved in, whether that was more research focused, more clinical, or shadowing? What can students expect to get involved in when they're in Lebanon?
I think, Dina, real quick, I just want to add to clarify something in the presentation for everyone else on the call. As a part of this experience, there will be a big research component of it. When we were there, there was a study which was affiliated with the University of Michigan Medical School. The PI is actually on the call with us right now, Dr. Ruba Al Fahmi. So there will be some prep work beforehand, assisting with data collection. There will be data collectors there, most likely working with us or whoever will be a part of the program for this year. And then there will be work afterwards. So I don't know if the exact details of this. Dina and Ryan and Dr. Ali and Neil have been very hard at work clarifying all of this. So I'm not sure how much is available now, but I know there is a project in the works for the upcoming internship class as well. So I just kind of wanted to make that clear as well, that that's a part of this opportunity. Um, yeah, Dina, sorry, not to divert the question.
No,
Um,
that's totally fine. Yeah, definitely there will be opportunity to engage in research with both AMIL and AUB. We're starting new projects. There's also existing projects that you'll be able to work on. So if that's something of interest, we'll get you involved in that and you can kind of take that as you will as well. So I guess back to our conversation, just asking about what did a general day look like for you, your main activities, what you were most involved in, whether that was research, clinical, shadowing, volunteering, etc.
So I can start us off with this one. I think it also just depended on what phase of the experience we were in. So I'll first just like talk briefly about what the first week looked like with the Amal Association, and then I'll leave it up to Ziad and I want to talk more about the AUB aspect, just because I didn't get to see that or experience that. A regular day in Amal at work, what's called interning with Amal looked like waking up around 7:30, hopefully 7:30, and then taking a taxi to the Haratrek clinic, which was about 15 minutes without traffic from the area that we were staying in. And as soon as you get there, you could see, how they're just like high patient traffic as soon as the clinic opens up. So what the first week looked like really was observership, seeing how the different medical staff were doing triage, treatment, and also the different specialists that would come in. So it really just contained observership from that first week from around 8 a.m. to around 2:30 p.m. But in addition to just observing things later on, you might have the capacity to get involved, but it's more so getting involved in things that were more so qualified to do things like helping triage, and that's it's things as simple as applying blood pressure cuffs onto patients, speaking with patients about simple matters, but of course not diagnosing anything or actually offering treatment. That's the responsibility of the physicians and the other healthcare workers, and we were really just there to learn more than anything.
Yeah, I think Neil covered some of the time in the Amil clinics. I was there for a bit longer, but a lot of it is being in the clinic. Our main partner there, Dr. Ali Ghassani, we spent a lot of time with him. He's kind of like the main point. He's a general practitioner. I mean, wow, you see like everything. Like you
Yeah.
see so much stuff. I think maybe my experience might have been a bit different. He would like joke with me that I'm like bad luck for him because he would see like the craziest cases. So it was super interesting, and just to see the type of medicine that needs to be practiced in this setting, like kind of a bit lower resource than maybe what we're used to here. But man, they are so smart. I mean, oh my God. It was really incredible to see what they were doing there. Um, and yeah, I think the biggest thing that I want to emphasize, and maybe there'll be more opportunity to talk about it there, is like this is a really a learning experience. Like Amil is a phenomenal operation. They have 30 centers. They have all the specialists there. Like you will not be contributing too much, to be honest. Like you can help in the way they tell you to help, but it's more that you are there to learn. Um, like it's really a very smoothly run operation. So it's super, super impressive to see. And I think big takeaways for me, and maybe I'm jumping the gun here with the question, so I won't say too much, but just seeing how they operate, kind of the culture there, the patient, how they interact with the patients and the differences between here and the US. Um, but yeah, I mean, such an amazing experience from the clinical end, and I can kind of talk about more of my experience beyond that, but I'll leave it for Ziad for now.
Yeah, I also wanted to add, it's not just working with Dr. Ali Ghassani, the GP.
Hmm.
I mean, you can work with whoever you want. I actually worked in several clinics when I was there. Um, the one that you'll probably spend the most time with is the one in Har because that's where Dr. Ali is. Um, but you can go to like I spent a few weeks, or not a few weeks, sorry, but like a few days in Burj Hammoud. They have like a three-story building there, which is partnered with the Armenian Red Cross, so you can see more different kinds of patients. They have an orthopedic doctor there, an ENT doctor. They even have like a small ER. They call it an ER, but they just deal with like major tr minor traumas. So like cuts. If there's any like acute things that they can deal with there, they can take care of it there. Um, so there is a bunch of diverse cases. There's also they have like almost every kind of doctor on staff. I was with a pediatrician at one point, an OB at one point. They have psychiatrists as well. Um, Trying to think what else they have. But the point is, it's a very di you can make the experience what you want it to be, and it doesn't have to just be with a GP. So there's that. Also, just seeing how the clinic itself operates. I mean, that's something in itself that I spent a few days just shadowing different roles in within the
Hmm.
clinic. Going between the pharmacist and the social workers. I even went on a site visit to a school to see how they do like their education programs for people in the area. So it's an experience not only medically, but you get to see like all aspects of the work that Ahmed does and how they implement it in the communities they work in. So
Yeah, and I think Neil, I believe you were with me, but we saw some of the work they do in terms of like social services
Yep.
and like They were doing like programs in terms of like training like migrant workers. Like the work Amal does is really, really expansive.
Yeah.
Obviously we kind of came in and they with like more of a pre-med focus, pre-health health focus. I think, the three of us were kind of the guinea pigs, the pilots. This year there will be more definition to the internship program, but I think again we want to, there is flexibility. And we do want to make sure it's tailored to, for those who are qualified candidates, competitive candidates, we want to make sure that it's tailored to your guys' experience. But yeah, I'm really phenomenal. I'm trying to think of what else in terms of day to day. I mean, man, we ate so much good food. It was awesome. And it's Lebanon. I don't know how many of you guys are Lebanese or have been, but a beautiful country, like the best people. Everyone is so kind. And there's so much to do. Like I think it holds a special place, and the experience holds a special place in all of our hearts. Maybe me and Ziad a little bit biased, but being Lebanese and all. But I think Neil also, I would like to think it was very special for him too.
No, it was a very special experience. And, just because the day-to-day operations were so busy, you came out so hungry by 2 p.m. that you wanted to just devour everything else in front of you. But, I don't want to, we'll talk about food
We'll
later
talk
if
about
people
food
have
later. Yeah, yeah.
questions
Dina,
about
what's the
that.
next question?
That's secondary or tertiary.
Uh,
Before I forget, also, there is another program that they do that I thought was really interesting. Well, they used to do it the first year when I was there. The second year they stopped doing it just because of the security situation. But they essentially have like vans that go throughout the city, talking to the unhoused people on the street, um, and just checking in on them, making sure that they have medical services, access to food, and just making sure that they were okay. They stopped it the second year because of, like I said, security issues. I remember them saying something about how they were going to re-implement it, or that it was being re-implemented. It's just hard to bring extra people on because they just need to make sure that the government knows who the people that are going around in these vans are. Um, but if that's something they bring back, I highly recommend doing it because it was a really like a amazing and eye-opening experience.
yeah,
I
I think
believe based on the Instagram that the mobile clinic is back because I saw them post some stories and photos of the new operations of it.
This is separate than the mobile clinic. The
Oh,
mobile
it's
clinics
different
are
than
the
the mobile
ones that
clinic.
go out to like different areas throughout Lebanon. That's
Okay
something we
then.
also didn't mention. It's not just in Beirut. They have
No.
clinics through all of Lebanon, south
Yeah.
to north, and even to the east. Um, and we went on a few visits to those sites as well. Those are basically like three-story buildings with like huge, expansive, uh, almost every kind of practitioner. And they even have like programs with the elderly there in those clinics. Um, so the mobile clinics are the ones that go out to like refugee camps. That was the point I was going to make. But
I
this
think I
is
also
called something else.
I want to add also, like when you're there, guys, they're going to treat you like one of their own. I mean, we were invited to all of their events. We were invited by the doctor, by even the person who leads the entire organization for dinner. We went to the International Book Fair. Amal had a booth there. Everyone is so welcoming. We're sitting in on their weekly, meeting with the entire team. If you want to get involved in anything, I mean, we are going to have I think more of kind of a set agenda, but it is flexible kind of on our end planning it. And then also on their end when you're there, I mean they're so super accommodating. It's yeah, wow. I mean we can talk about more of the things we learned later, but it was really an incredible experience. Dina, I think we'll hand it back to you.
Wow, yeah, that was all so insightful, and I'm just echoing off what Ahmad was saying. Like this experience is really it's going to be tailored to you and your interests, and you have that opportunity to explore different sites, community, education initiatives, get involved with research. There's just so much you can do. Even though 2 weeks seems like a short amount of time, you can definitely fit a lot during that period of time. So I just wanted to move on. Now we talked a lot about Ahmed right now, but I know working with AUB is a newer partnership for us. I know Ahmad and Ziad, you both had the opportunity to be able to also shadow at AUB. So I wanted to ask kind of what was your experience like at shadowing in the hospital setting versus in Ahmed, and kind of things that you took away from both that you benefited from, learned from, etc.
You want me to answer this, Omar? Okay.
Yeah, go ahead. I'll talk more about the research part of it.
Yeah, so I spent pretty much a week, I think maybe even 10 days, shadowing in the AUB ED. Um, it's a lot different than NAAMN, I would say, just because the patient population is different. If you know, if you have any knowledge of how the healthcare system in Lebanon works, or just kind of, I guess, okay, maybe I should explain this a bit. So the way it works in Lebanon, or the way it works between these two, the patient population difference between these two organizations is that Alman is taking care of patients without like insurance. Mainly, like they have like a very symbolic payment, which is literally just like 5 cents. Sometimes even they waive that fee. So you're seeing a lot of people with who don't have like consistent access to healthcare. If they have consistent access to healthcare, it's Hamid. Um, Whereas the AUB, you're seeing the people who have access to the best healthcare in Lebanon. So the cases are way different. I would say also the way they manage the cases is way different because the resources they have in the AUB are a lot more than what they have at Ahmed. Um, so it is a way different experience than what you see at Amal. That being said, I think it makes the experience a lot more enriching because you get to see the two aspects of how medicine is handled in Lebanon. There are also people who are uninsured and have like the really severe cases that can't be treated by anyone else. They go to the AUB because it's the best center in Lebanon. So you're getting a lot of everything. And it is kind of it's nice to see both sides of it, I would say. Also, the doctors there are very, very nice. But you do have to go out of your way to ask questions. Dr. Ali was more, Dr. Ghassani was explaining everything to us, and it was really literally being spoon-fed to us. AUB is a learning center, a medical center, academic center, so they have to make sure they have a lot of patient volume, a lot of residents they have to teach, a lot of medical students they have to teach, and you're just someone there who's shadowing. So again, you do have to go out of your way to ask questions, but when you do ask questions, everyone is super nice, and they do want to teach you and do want to explain. It's just again a busy place.
Yeah, I think Ziad really nailed a lot of key points there. I think I want to add a couple things. I think one, generally, I'm assuming the people here on this call are pretty interested in global health, maybe quite involved in NAMA, nonprofit work. I think we all know the situation in Lebanon if we're here on this call or kind of in the Middle East. But I think it's one thing to kind of know it and another thing to be there and experience it. Even for me, I've like volunteered in Lebanon in the past. I mean, it's a very, great reminder. I think it gives a lot of perspective. I would like to comment more on kind of like the research work that was done there. That was in partnership with AUB and Amil. Yeah, like I was working a lot with the data collector hand in hand, kind of going to the clinics, encouraging, the staff, kind of informing them about this survey and telling them what's that. I mean, not so much to say in terms of like what Ziad said. I mean, it was mostly just kind of like pushing it forward. Um, but yeah, I mean, we can talk more about the research aspect of it. I think it's going to be very organized in terms of like doing the research there, and there's going to be like support from data collectors. Um, but yeah, I think the only thing I just want to recomment on Ziad's experience is like, you're seeing like the best healthcare and kind of like people who are literally paying like under $1 to get healthcare. And it really is something to kind of see that disparity firsthand. Um, we all know it, but I think being there and seeing it and experiencing it is a very different reality. Um, and I think also like seeing the work culture in these places, in AUB, in Amil, how do you push forward a research study? How do you work with these people? How do you learn from them? You're not going there to impose, what you think is how things should be done, or this is how I've done research. You need to kind of work with them. It's their environment. And I think it was really such a valuable experience for me because I'm interested in global health in the future. So it's a really great learning experience. So I think it was not like a super concise answer there. We can kind of talk more about it. But Ziad kind of just reminded me, of this, thing that I experienced and learned is this disparity that we saw.
What was the question about the day to day at AUB? I
I don't
didn't
know.
answer any of that.
UB. That was perfect. But Omar, that was great. That kind of segues into my next question about what were your guys' biggest takeaways, either working with Amin, AUB, doing research, etc. And how has your experience changed how you think about global health and medicine?
So I think Omar kind of described a lot of this just now, but I one of my big takeaways, and this is something that I tried my best like to prepare for ahead of time, which is really understanding that okay, there are disparities present, but it was completely different to actually experience it and actually see it because it gives you a fuller understanding. Of course, not a complete understanding, but a fuller understanding of how do disparities actually look like and what are people's day-to-day situations. So that was a big takeaway. But another one was also just the importance of learning from the staff themselves because they're coming from a completely different reality. Even if, our parents or even some of us were born in the region, that doesn't mean that we grew up in that same system. So I really I felt that there was value in learning from the people on the ground about how their system works, how they actually get the funding, what can they actually use the funding for. It was, those really small, seemingly minute details were especially important to the experience because it made me better understand of how is a organization like Ahmed able to be so sustainable and provide care to some of the most underserved populations in Lebanon. And then another large takeaway was we were talking a lot about, the disparity between the patients at AUBMC and the Amil Association, but, the patients who are also receiving care at Amil are not monolithic. You have Syrian refugees, Lebanese citizens impacted by displacement, or just Lebanese citizens who are facing financial pressures. But then you also have migrant workers, some of whom don't speak Arabic fluently. So it was really informative to see how the Amal Association staff sort of, I guess, navigated those different cultural, financial, socioeconomic barriers or differences. And it's kind of just informed my understanding of global health, which is, viewing it as very similar to public health, but done on a level that involves collaboration between partners. And really the one that's supposed to be taken, the lead is supposed to be taken by those who are actually on the ground and best understand the communities that are operating, that exist there.
Even also to build off of Neil's point, I mean, he said that the population at Amil is diverse. The population at AUB also is diverse. Like I was saying, I mean, there are people who like refugees, people who don't have insurance going to AUB just to get treatment because they don't have any other options. There was also diplomats there. There was also foreigners from different countries just going to because this is the best hospital that they have access to in the region. Um, so I mean, you see everything in both cases. And yeah, again, echoing everything Neil said about global health. Couldn't have said it better. Ahmed is works on so many levels, and I mean, to think that you're going there to contribute something. I mean, you are helping them in a way by being there and I don't know, making them smile or something, but and are working with them. So no, you are contributing, but I mean, you're really there to learn from them. That's the key thing that I think you should have going into this experience, that it's a learning experience. Because there's so much you can learn from every day-to-day thing that they do, the way they talk to their patients, um, the way they, go about their work, going to several different sites, managing all the different levels of administrative work they have to go through, just to see one patient. So really unpacking all the layers that go into each patient visit, I think was a really valuable thing that you can do if you go there.
Yeah, I think hard to follow Neil and Ziad with those answers. I think a big thing, of course, I echo everything they say, but I think work culture, just there's the American culture, work culture in the American way, but I mean, this is a completely different circumstance, a completely different, environment. And fine, we are all Arab on the call, but this is, I can say probably for a lot of us here, it's not like grew up there or lived there. I mean, it's different, and I think, again, a lot of these things, maybe you guys have been familiar in a global health setting. These are things that are said, and, your PI says it and your team members say it. It's a completely different reality to be there. I had worked in a global health setting, Henry Ford, for about a year before this experience. And, we have guests coming and I'm working with international partners, but some things you just don't fully click until you're there. So I think that was really great. Yeah, I think really being there, seeing it, understanding the work culture, and just learning from everyone around me. I mean, the operation there is so impressive. These people are so talented and smart. Um, yeah, lot to learn. But yeah, I'd say to add on to what has already said, work culture. And I think also like, even, being Lebanese, having been there, we talked about the disparities between AUB and AML and the patient population, but I think just generally the high level of inequity that you see in Beirut and in Lebanon, it does take some getting used to. I mean, you go like 10 minutes, it's all like G-Wagons and clubs, and then you go to like the areas near the clinics and it's like all bombed out. And it's pretty surreal, to be honest. It does take a minute to get used to. And again, these are probably things we all know about in the call, but to be there and to see it in person and to be a part of that is completely different.
Yeah, and in talking about that, cultural difference and just environmental difference, last quick question before we move on to Q&A. Is there anything that you three wish you knew before going, or any advice you would give to people coming, whether that's their first time in Lebanon, or maybe they've gone to the Middle East, but this is their first time alone, working in a setting rather than for like seeing family or tourism? What sort of advice would you give to someone that's interested in this opportunity?
So I'm not Lebanese. I think that that part is kind of clear. So just getting used to it at a time, I had to do a little bit more research and better understand the context that I was working in. And one piece of advice that I'd really recommend is just reviewing a little bit of Arabic terms and Lebanese dialect. So I'm Iraqi. I speak the Iraqi dialect. There was like simple terms that I didn't realize that Lebanese people use that Iraqis don't use, or vice versa. So just learning those simple differences, but also medical terms. It's going to be a lot easier to follow what Dr. Ghassani and other physicians are explaining if you have a basic understanding of um, symptoms, the different organs, and hopefully soon we will, for the people who are going to Lebanon, we will provide those medical terms, a list of medical terminology in Arabic to know. So learning those would be pretty helpful. But then another thing is, and this might sound cliche, but it's just really keeping an open mind, and not just an open mind about cultural differences, but also about specialties and those kind of things. A really good example I could give is that while I was working, or while I was interning with Dr. Ghassani, there was times that I actually spent with the pharmacist. And although I'm not someone who thought of myself as interested in pharmaceutical services or pharmaceutical care, I really felt I learned a lot from that experience, just because I saw a different side of care that often isn't seen by a lot of pre-med or medical students. So I highly suggest keeping an open mind, visiting and observing specialists who are in fields that you might not think you're interested in, but you might come out with like a different understanding.
Yeah, I can go ahead next. I think two things. The question was, what advice do we have? Or what's one thing we knew before going in?
Yes.
Or kind of both? Okay, I would say kind of like advice or going in. I'll say more like advice in terms of like how to make the most of the experience. I think one, and something that I followed, was try to learn as much as you can from everyone around you. Like everyone really is like a wealth of knowledge and experience and perspective, and I mean these people have the most interesting stories, even just about their lives. I mean, I think there's just so much to learn there. And I think too, I was there for quite a bit. I was there for 2 months. So I had time to get over this, but I think the faster you are okay with being a bit uncomfortable, the more you're going to get out of the experience, right? Like, fine, I can speak pretty high level Arabic, fluent Arabic, But there's little things you might not get, like the jokes or like these kind of small things. That's okay. Like it's fine. Just be friendly, be respectful. Like everyone there is super, super nice, super, super friendly. And I think by the end of it, we had made Ziad was with me for a bit. Neil was with, I mean, we had made some friends. We're going to Tripoli. We're like visiting places. We're going hiking. Beyond just going to the center and coming back, like there's a lot to do in Lebanon. And I think even like meeting the different people in Amil that maybe you don't know before, like I think just put yourself out there, right? And the more you're willing to do that, and maybe it's a bit out of your comfort zone, I think the more you're going to take away from the experience.
Just to even further echo the 2 points that Neil and Omar made, there's a word in Arabic, hakwaje or halbu. You just have to go and talk. Talk to everyone, ask as many questions as possible. Be open to trying new things. Because at the end of the day, I mean, if you don't ask, if you don't, you don't talk to that one person, you're never gonna talk to them again, you know? And I think that's probably the biggest piece of advice I would give to anyone going on this trip is just be open-minded, explore, talk to as many people as you can, ask as many questions as you can, because they know you're there to learn. They know you're some kid from America who just came over to talk to learn what Ahmed is about, to learn what is going on in the AUB. So the more friends you make, the more people you talk to, the more opportunities will present themselves. And the worst thing that can happen is they just aren't your friend. But everyone in Lebanon is incredibly friendly, like to the point where it's actually kind of weird. Like you'll meet someone in the morning and at night you'll be going out to having coffee with them. That's just how the social culture is there. We literally went to Tripoli, a city 2 hours in the north, on a bus to meet up with someone that we met like a week earlier. So, and they took us a tour. They gave us a tour around the whole city. And we had food with them. They wouldn't let us pay for anything, of course. At several restaurants. And yeah, we spent a whole day with them just because we talked to them once. So the opportunities will present themselves as long as you're open to them.
You
Yeah.
need to learn. Oh, go ahead, Omar.
Go ahead, Nick, go ahead.
I was saying you need to learn how to beat them to paying. So it's
Oh
not
yeah,
just
yeah.
leaving for the
Oh my
bathroom.
goodness.
You got the second you walk in, you need to give a little like head nod to the waiter, and that's their little trick, I guess. But you
To
need to beat them to
clarify
it.
what Ziad said is actually they tried to pay for everything, but I beat them to it because
Yes.
I had learned by the end of the trip. Yeah, it's like guys, you think it's bad here with the Arab here in Lebanon, it's like a competitive sport. It's ridiculous.
And the
Um,
waiters are in on it.
Yeah, yeah, but yeah, I mean, well, the social culture there, guys. I mean, I know I'm seeing a lot of Arab names here, but there it's like next level. I mean, it's people are down to go out. It's the social culture is such a huge part of being there. Literally, your people make plans on the spot, every night, every day. So again, like put yourself out there, ask questions. I think this is how you make the most of the experience.
I was I was there during Ramadan, just to give you guys an example. I was there during Ramadan and we had made a plan like I think at iftar time I was texting Dr. Ali Ghassani on WhatsApp to go eat to go eat suhoor at like a random cafe at like 1 a.m. and we stayed out until I think 5 a.m. that day, and we were both back at the clinic at 8 a.m. So the social culture sometimes outcompetes the work culture. They work hard and they play hard. Just be prepared.
Great. I love that. And the weather will hopefully be really nice around May, June time. So lots of opportunities to explore. Any final words from you three, or we can just jump right into audience Q&A. Feel free to unmute yourself, put questions in the chat, and we can answer them.
Just to, I don't know, while people prepare their questions, I just want to echo Neil's point even more. The more you know about medicine, the more you know about like Arabic terminology in medicine, the better your language skills are. It will take you bounds and leaps ahead, in this experience. So just prepare as much as you can for it.
If you have any questions also about the application itself, logistics behind that, also happy to answer, or you can direct questions to any of the panelists today.
Thank you for all your answers. And I feel like I learned so much more about the internship. My question is about how the costs could change, like if your family lives in Lebanon and they would provide like the transportation and the housing as opposed to like doing it. Like I know the internship provides it, but is that possible or are we supposed to like stay according to like everything the internship has to offer?
Yeah, I think I don't see why that would be a problem.
Okay.
If it's more comfortable to stay with your family, if it makes sense, obviously would need to be nearby. Um,
Yeah.
yeah, but again, we're flexible. We want the experience to be best for you.
Mm.
And so I would not, we're flexible is the answer. I wouldn't be so concerned with those details.
Okay.
Yeah, I
Thank
had
you.
someone with me who was in a similar situation. She had her family lived like 10 minutes down the road. So she drove every day almost.
Okay, yeah. Yeah. Thank you. Because, between like the families and their apartments in Beirut, it's like maybe like I could use one of those too. So thank you.
Yeah.
I'm seeing a question in sorry, Rita, did you have any other questions or were we able to
Nope.
address it?
No follow-ups. Thank you.
Okay, I just want to address the question in the chat real quick. How large is the cohort that travels usually? It depends. Again, we've been piloting this, so for the past few years, it really depends on Almond's capacity and how much they can take. I think like 2 to 4. We can also, if we have a super competitive, application pool, we can see how flexible they are to do multiple points throughout the year. And also we understand, with medical students, maybe not as flexible. So we really want to work with the people who are competitive that apply. Um, but yeah, I think it really just depends on Ahmed's capacity, and typically it's been like 2 to 4 people. Maybe we will do like rotation, half an AUB, half an Ahmed. It just depends how many people apply that are competitive, really. We have another question.
Hi, I was just wondering when you guys will know the exact dates that the internship will be. I'm undergrad at Michigan and looking to take some spring classes, so I was just wondering if it would intersect with the 2 weeks.
Yeah, so the good thing is that we can work around your schedules. We do say mid-May to early June based off this is the time when an AUB will expect us or like are expecting us at that time. So we'll definitely work with you on what dates you can come in. It'll still be that 2 weeks. Maybe mid-May might be better if you're taking summer classes or if you're taking spring classes, maybe in early June. But we'll work around that schedule, but it'll be around that time period.
Okay, thank you so much.
Apply for those summer classes.
Yeah, so you can do it later. Yeah.
I'm kidding, but it's flexible, but again, based off of Ahmed's availability for the most part. But we're gonna work with the people that get the internship to make it happen for them.
Any other questions that anyone has? Could be application based even. It is extended, so you have a few extra weeks to get those in and get those letter of recs as well.
I think I'll have a question for Ziad and Neil. And I think that would be probably relevant for the applicants. What do you guys think would, I guess, make a successful applicant? We've kind of hinted about it throughout our experience, but what do you think are those traits or kind of the mentality these people should have going into it?
Just based on the traits that we've been speaking about, I think a big one is someone who shows a willingness to learn, someone who shows, that open-mindedness. They've shown like consistent involvement in things that are related to global health, Lebanon, etc. It's sort of wouldn't make much sense for someone who's never heard of Lebanon, never heard of like the Middle East. I know everyone here is Arab, of course, but someone who's shown consistent interest, that's what would make a good applicant. But really also that point of someone who shows openness and willingness to learn, because I mean, we already discussed it, but really over there, your role more than anything is to learn. And the people there, both at from what I'm hearing at AUB and at Ahmed, they really want you to learn. They're there to help you. And it's someone who will be successful there, is someone who's willing to go out of their way to learn.
Yeah, pretty much what Neil said. Someone who also has clinical experience, I would add, and can speak pretty good Arabic and understand pretty good Arabic. Not to belabor the point anymore, because Christopher has a question. Don't want to keep him holding.
Yeah, Christopher, go ahead.
Oh yeah, touching on the Arabic thing, in terms of like for example, for myself, I don't speak perfect like Arabic, so I mean, I speak good Arabic, but not fluent. So have you guys had applicants like that, or do you guys usually just take like completely fluent applicants?
We had one. Malak was there, right?
Yeah,
Um,
Malek was there. I mean, look, I would say you will get more out of. Do you understand Arabic well?
Pretty decently.
Okay, I would say like if you can understand what's going on, if someone is speaking only in Arabic to you, then you would be good to go. Because again, the patients at Amil, the people at Amil don't speak English most of the time. Um, I wouldn't, most of the people there can speak some English, but a lot of them are French educated. They didn't learn English in a school. They learned it on their own. So again, it helps. The more Arabic you know, it will help a lot. AUB is a different story. It's the American University of Beirut. They all speak English.
yeah.
Sometimes they speak more Arabic, more English than Arabic, but that's different.
I think also, in the area that we're designating you guys to stay, I mean, unless you have your own situation, Hamra, Beirut, you can, a lot of people will speak English there. You'll be able to get by, but especially with Amil, I mean, yeah, it's understanding what's going on. I mean, if you can understand decently, great. You will get more out of it if you speak Arabic. And I mean, hey, it's what is it? It's January right now, so you got some time.
Your Arabic will get better. This is what you
Oh,
should
yeah,
say.
100% as well. Like even in the first 2 weeks, like fine, I say I'm fluent, but there's levels to it. I think it improved so much just being there. I came back, it felt more comfortable to speak Arabic than English. Um, so it will improve very quickly, Christopher, as well when you're there. But again, you need to be okay with you need to be okay with not being fluent, or being perfect when you speak, and they understand, right? I mean, even for like me and Ziad, we speak pretty fluently. They pick up on it. So
I appreciate it. Thank you.
good question.
Awesome. We're nearing toward the end of our session. So if any of you have any lingering questions, you can feel free to send us an email. Also reach out to any of us personally. We're always happy to answer questions, but this email reaches all of us. So we'll get to your email as soon as possible. If you have any questions about the application or just want to talk to anyone about their experiences again, everyone's welcome. So thank you all for joining today. We'll stick around and hope you guys have a great rest of your evening.